Epilepsy is a really common illness. It's the commonest serious neurological illness in the world. At least 10% of the world's population will have a seizure sometime during their life, but most of them are just one seizure. A lot of people though, 1 or 2% of the world's population, have recurrent seizures, so it's a huge public health issue, and it affects mainly younger people.
My seizures started with a sort of aura, so you get like a feeling that you're about to have a seizure. And that's not fun because you know what is going to happen in probably the next couple of minutes.
At the moment it's so bad that I have that aura all the time, which means I kind of get no warning when I'm going to have a seizure. And all day I'll feel like my right leg's kind of going to give way, but I won't know when because I have it all the time.
So I'm trying to look at the transition into an epileptic state. So when a patient undergoes a transition into a seizure, their brain undergoes a very extraordinary change in the collective behaviour of their brain. This can give us insights into the mechanisms that are causing it and help us design future treatments that are pretty novel.
We're working on new techniques to deliver drugs directly to brain. All this is animal work so far, but we've developed systems with collaborators from other universities as well, where we can put the drugs that we use directly in the place that the seizures are coming from and avoid the side effects in the rest of the body that these materials cause.
My role within the group is to oversee a lot of the computational modelling that we do. So we try and use mathematics to try and understand what happens during epileptic seizures. And this work feeds into the medical bionics program, where we're hoping to build devices that can hopefully predict and prevent seizures before they occur.
Elise had previously been investigated. Part of it has been that she'd had investigations with electrodes that were incomplete in terms of they couldn't provide the full picture of the nature of the seizures and where they were arising. Since that time, we've had access to newer technologies. We have higher density EEG recordings where we have many, many more sensors. It's almost like giving us an image like an electrical weather map to be able to really pinpoint where the electrical storm is arising from. So we're hoping that this will be the next step to providing her much better seizure control.
Pablo's seizures came from a part of brain involving speech. The other problem was that we didn't know where his seizures were coming from for many years, so he'd been very extensively studied as a kid. With some new scanning techniques, we were able to see where it was coming from. So we had a very complex procedure where we implant electrodes and we stimulated that area of brain, and we figured that we could probably remove the area that was causing seizures without interfering with his speech.
So we were able to map the abnormality as well as the normal functioning cortex to really target what was necessary to have that seizure control.
Well, I believe that we're really at the brink of something great right now. We've just finished a clinical trial which has shown for the very first time that prediction of epileptic seizures is actually possible.
Probably the most satisfying thing you get to do as a neurologist is treat people with epilepsy, particularly if you can offer surgical treatment, because the impacts it has, particularly for a young person, if you can completely stop seizures for good, I mean, there's nothing like it.